Welcome to VidZet. I'm Dr. Ted Noel. My wife and I are back from a bucket list trip to Alaska, and aside from a little bit of jet lag and a threatened bit of laryngitis, I'm here with you again today. I was going to talk about the new version of haggis that the Senate has put together, but instead of that, I think I want to talk about the Charlie Gard case. Now, this morning at a very early hour, I awoke with a vision of Charlie Gard in the hospital, endotracheal tube through his right nostril, being supported on all sorts of machinery with a uniformly fatal disease called mitochondrial depletion syndrome. There have only been 16 cases of this ever reported, so nobody really knows much about treating it. And as a physician trained in anesthesiology and critical care medicine, I sat on my hospital's futility of care board looking at cases like this and helping to put together a policy on how to handle them. And basically what we said was, when we have a case where the family is a bit resistant, we call in a second opinion. We assess and determine that any further care is futile. Then what we do is come together to see the patient's families, their legally authorized representatives, and present the fact that any further care is futile. And we try to persuade them that it's time to stop doing more care. Now, there are a couple of reasons for this. One is cost. You're spending money with no benefit. You're also burning out your medical staff by having them do things that have no medical benefit. But at the same time, the medical staff is not the owner of the patient. The patient has designated his own representatives. And frankly, unless you have someone with no immediate family, the courts have no business at this point, because all of the ownership rights, which are the patients, are delegated to the family. And the family makes the decision. That's not what's going on in the Charlie Gard case. Now, mind you, his disease has been uniformly fatal at a fairly young age. So we don't have any reason to expect that ordinary treatments are going to be beneficial. But keep in the back of your mind the fact that there is a doctor from Columbia University who has presented the idea that there is a treatment that might help. And his published comments say that there's about a 10% chance of helping Charlie Gard. Now, how does this impact on the moral situation? Let's go back and look at some history. Charlie Gard was fine at birth. A few months old, he started having problems, and the parents took him to the hospital, where he was admitted and ultimately found his way in the intensive care unit. Then his diagnosis was made, and it was clear at that point that he had no real outlook. But what happened next doesn't match the pattern in my hospital. Instead, what they did was they went to court for an order to bypass the parents and disconnect Charlie Gard from life support. Notice what they did. They declared that the parents no longer have an ownership interest in their child. Now, it is a fundamental principle coming from English common law that parents are presumed to have the child's best interests in mind with whatever they do, unless there is a manifest case of child injury or abuse. And this is clearly not the circumstance with Charlie Gard. What we have is parents who truly love him, who are hoping against hope for a way for him to recover, and are grasping at any straw that might come their way. They went and challenged the hospital's action to try to force them out of the way. The hospital is saying, we own Charlie Gard, and you as the court can enforce our ownership interest. Well, now wait a minute. Who is the hospital? The hospital is an organization which is a subpart of the National Health Service, which is socialized medicine in England. It is single payer. Now you have a term that applies to the United States. It's single payer insurance. Now, they went to the court. The court said, unplug him. They appealed. The appeals court said, unplug him. They appealed to the highest court in England. The highest court refused to take the case, but they stayed their order long enough to let the Gards appeal to the European Court of Justice. Now, the European Court held that they had no interest in taking the case. Therefore, Charlie Gard should be unplugged, done, over with. But for some reason, the hospital didn't follow the court order, and shortly thereafter, this doctor from Columbia University popped up and said, hey, I have something that might work. Now, with 16 patients in the total history of modern medicine having this problem, you can't do double-blind randomized studies. You have to do what's called a therapeutic trial. And what might happen? 90% of the time, according to this doctor, it's not going to work. Well, but what will happen the other 10%? It might work. Let's look back at another case with which I'm intimately familiar. Dr. Leonard Bailey, with whom I had worked at Loma Linda University, did a baboon heart transplant into a child known as baby Faye a few years ago. The idea was we didn't have baby hearts to transplant, and this might create a new way where we could get hearts for babies with these incurable heart defects. Well, baby Faye eventually died. He wasn't able to save her. But what happened was, all of a sudden, a lot of parents who had children with irreversible, massive brain defects, things like microcephaly, anencephaly, and so on, where they could never function as any sort of a human, never have any sort of human awareness, made their children available as donors. And now we have hundreds of children whose lives have been saved by these donors. We went a different direction than Dr. Bailey anticipated, but the outcome was wonderful. And with Charlie Gard's case, we will learn something, and that something will be useful somewhere. We just don't know for sure where. At the same time, if we allow this to happen, now mind you, the Gards put together a GoFundMe type page, and at the last number I saw, they had 1.3 million pounds committed to Charlie's therapy. That's more than enough to take care of anything that's reasonably possible in his situation. So the National Health Service has no financial reason to hang on to him. They have no moral reason to hang on to him, but instead now the hospital, which had dragged its feet about unplugging him, is now appealing to the court. They're appealing. They're not allowing Charlie Gard's parents to appeal. They're appealing, saying, we want Charlie Gard to go get this therapy. Well, remember, what's happening here is that the state is saying, we own Charlie Gard. You parents have no rights with regard to him. Now, let's come to America and look at a single-payer system. It's called Medicare. And unfortunately, I was forced onto Medicare. Now, this September, it'll be because of birthdays. Prior to that, it was because of a disability. I have a neuropathy that prevents me from practicing my specialty now. But that neuropathy forced me onto Medicare disability, or Social Security disability, and onto Medicare. I don't get a choice. And what insurance company denies care more than any other? Medicare. Do I have a right to appeal? Yes, but the chance of a successful appeal is close to zero. Further, when I look at it and they deny my appeal, can I go outside to get therapy? No. Now, mind you, I've saved money through my career, so I probably could pay for something. But it's not legal for a doctor to do it. He can never see another Medicare patient if he does it. It's the law. In other words, I have become the property of the state, and the state tells me what I can do and what I can't do. I am owned by some faceless, nameless bureaucrat in Washington, D.C. I no longer have my personal property right in me that natural law demands. Now, this is what the Charlie Gard case tells us. Single payer denies every personal right under natural law. It denies what our Declaration of Independence talks about as the inalienable right to life, liberty, and the pursuit of happiness. In other words, it is a complete reversal of America. We need to do everything possible to get rid of any thought of single-payer health insurance in the United States. It is evil. It is not just a bad idea, it's evil. It takes away your right to determine your life. I'm Dr. Ted Noel. Thanks for watching.